Good morning, good afternoon, good evening, wherever you are watching this information from the Science Institute of Educare. You can get more information from my website, mychild-educare.com, about me and my work. So I am considered as a pioneer starting multisensory integration that has helped many premature babies have a normal life and control the morbidity, and they become professionals from extreme low birth weight. It is a combination of trying to protect the brain from the trauma and the global developmental delay that trauma can cause, and also from the um, neuroplasticity that was intensively used as the research was evolving. And the studies were coming up since 1990 that has helped many children, normal newborns having a character development, the attempt to create a holistic health development, physical, mental, psychological, social, emotional, and spiritual wellness was accomplished even with the premature babies, extreme low birth weight, 25 to 26 weeks. And majority of the ADHD and ASD symptoms were reversed by using the multisensory integration approach with a dietic approach of family unity and compassion to work with uh, the child with atypical development 24/7, 365 days. The goal here is to create a whole child, which is physical, psychosocial, emotional, intellectual, and spiritual wellness. And what if we empower every parent on earth with the knowledge about the neuroplasticity, how it creates the structure and function of the brain, and it is through playing with the children, through universal nurture, as well as paying attention to the nutrition and supporting the skills, which is physical, gross motor, fine motor, vestibulocochlear, vibratory, as well as the interoception, as well as proprioceptive development, which are the three sub-main sensory input, the main senses being sight, sound, taste, touch, and smell. So the sensitization is what they need to know about the neuroplasticity. Education is about how to impart this, how to support, how to build the skills and strategies for extracting the inherent strengths and powers of every child who is born with the faculties of amazing development. And it is not like a curriculum that we do for primary school, where there is a content delivery and answering questions and assessing a child. It is so much related with the relationships and the bonding between the child and the caregiver. Here are some pre-session questions that you can answer, and there will be post-session questions also. And please don't look at the answers. Just this is a self-assessment. Nobody is scoring or testing anybody. Whenever a neuroplasticity is the basis for somebody to understand the development, and if you get a case with from physical illness of repeated asthma to a case like that is this slide is describing, we look at what happens in a child's life. Why is it so? And what causes some of these systems? What happened in the pregnancy? What happens in the family relationships? What happens with the peer relationships? And so on. So neuroplasticity does open the door of investigating and trying to find the root causes of current behaviors that have the basis from neuroplasticity that was dysregulated or disturbed 0 to 36 months. Here is a case. These are my original cases. I'm not revealing any name, and some of the people may feel very familiar with that because these are the things that are happening in the world. A 6.5-year-old comes for being suspended from the school because of her oppositional behavior, lack of respect for the teacher, not respecting authority, not paying attention, darting out of the classroom, not learning well, does have a aggressive behavior towards the peer group and hurting the children. And mom was desperate. A very good looking mom, very compassionate mom, brings the child. In the history, there is a concern that a 14-year-old sibling or the sister slashed her wrist to end her life. But she was placed in a neuropsychiatric facility, and after 2 weeks inpatient, she was discharged with some medications, which she seems to be stable. When looking at the audiovisual screening, she was normal, growth percentiles were normal, and her Vanderbilt scale shows 9 out of 9 in attention, 9 out of 9 impulsivity, hyperactivity, 8 out of 8 oppositional defiant disorder, 4 out of 8 anxiety neurosis. And putting the lens of trauma and neuroplasticity, the case was assessed because that might change the whole scope for therapy somebody wants to give, not just the medication. So we are assessing children by the scales and symptoms that they present, but the root cause for all of these goes back to 0 to 36 months or 0 to 5 years, grow environmental experiences that were given to them. So neuroplasticity itself is learning. You don't have neuroplasticity to create a learning atmosphere. The central theme is to align with established science, evidence-based medicine that is almost 50 years old, that should be implemented in the wellness checkups for every child who is born. It is this brain development from outside to inside in a hierarchical fashion, from the lower end of the brain stem, to the middle monkey brain, the middle brain, the mammalian brain, to the executive brain, which is a exclusive human properties. The bottom up, it is called. The top down comes as a behavior that we are seeing, we are encountering, but we are not connecting the dots that the current behaviors might have had their roots in 0 to 5 experiential neurocognitive development. Parent-child interactions have a major role, and their early relationships have a major role, whether they were getting good, positive, warm relationships, responsive caregiving, it back and forth, servant return cycles. That is important. The first 3 years are a period of rapid growth. Let's take it from the beginning. Here is an infant who's just delivered, had a good sensory input, probably he was talked to, stories were read to. Look at the eyes looking at, why am I here? Who are you? And what am I doing here? A question. Button was not crying. He's nice and pink and warm and just trying to find out why he's here or she is here. I don't know the sex. But then somebody must have said, hey, the baby's upwards will be low if he didn't cry. Although he's pink, nice and well and looking alert, somebody gave a little sweat. And so he's crying the distress. Would that infant have pain? Would that infant have permanent memory of this? So learn about the implicit skills and capabilities of every newborn. I bet every mother, every father, every family wants a normal newborn, above average intelligence and ability to fit well into the society with the good working relationships, peer relationships, and being an excellent student in the school. And they ever wait for the infant to crawl and walk and give interact with the adults the way they expect and be the brightest child on earth. So I also put this one in because we have an Einstein gym mat. Nobody uses it. It has an excellent purpose, and it is to unleash the Einstein in every child. Because there is an architect, there is a scientist, there is a lawyer, there is a philosopher, there is a Newton, Einstein, sculptors like Jakanachari, who are there. And this is the beginning stage of cognitive development from birth that the infant can be exposed to. And when we have tummy times on this mat, and then we do have care for not just keeping them on one side or on the back, that leads to plagioccephaly and then the headgear. We can prevent it when we use tummy times, which are also educational. So every baby that had that strange look, and this baby, they all are born with 100 billion cells that are waiting to connect with the world and develop a beautiful brain, a robust connectivity to be a human that is close to divinity. Because we are the only ones in the whole creation who can change our reptilian mammalian behavior to the divine behavior through human values and wholeness of education. Long before the child even walked, their brain pathways have already got situated to either survive or thrive from 0 to 12 months. Every touch, every smell, every sound, every experience becomes a permanent part of the brain structure. Here is an example of these networks. Just imagine for a moment what we see. We look at the depth, we look at the color, we look at the shape, we look at the purpose. The interoception is the purpose. But every baby has that because they're born with implicit skills of love, sympathy, and empathy, memory, intuition about our interactions with them. They know if you are intentional in throwing articles or books, or if you're intentionally being loving, caring parent, trying to interact with them, or if you're just doing a duty but you're vexed with your duty. That is interoception of every newborn. Is it genetic? 50% is genetic blueprint, but 50% is that they have mirror cells. They can watch an adult, try to imitate them, and when they feel that something is not very welcoming, they know how to withdraw. They don't know how to close their ears and run away or run away from the sight. So they shut down what they want to see. They shut down what they want to hear. They shut down what they want to eat. So a common example is a baby cries, and if there is a mother who is inebriated, depressed, and not paying attention, or somebody said, "Don't pick up the baby just got fed, you're going to spoil the baby," that baby will, after a while, stops crying. Understand that can be an anaclitic depression where the baby feels I have to wind down into my own self because the world doesn't care about me. So we do need to be intentional, demonstrating, guiding, supporting their wholesome growth and development. Reflect for a moment what we see as I was describing goes through the eyes and through a chemical mediators makes a connection to create an electromagnetic field, actually a wire that transmits the information to the back part of the brain, occipital cortex, and from the occipital cortex it goes to the frontal lobe to know the purpose of it. And in this same situation, understand about the lazy eye. We only have up to first 12 12 months. By 6 months, a lazy eye should be discovered or detected. And if the eye that is normal is not blocked, the vision will atrophy and become legally blind in the eye that is lazy. If there is esotropia, exotropia, esophoria, so many names are there. And then Foster Kennedy syndrome is there, which is a false representation of lazy eye. But it is sad to see somebody become legally blind, very high myopia and retinal detachment, laser surgery, and even if it is fixed, they cannot read very well. They cannot function very well because only one eye is working. We are causing the learning disability. So the proper time to detect this is 6 to 9 months, and interrupt and intervention has to be taken care way before 12 months. So for the vision or the sight or the hearing or the audio, 0 to 12 months is the experience expectant development. Here again, another magic. When we are seeing from outside to inside, we have to accept it. We have to have an affective mood of wanting to receive the message. And once we want to receive the message, it needs to be transmitted. And these receptors, the synapses, which are 3 million per second between sight, sound, taste, touch, and smell, as the information is received, it's a magic. It's a magic, and it is this magic that causes the moods, the cognition, the attention, the focus, the control. And so as we dive deep into it later, this is an animated version of how the dendrites of this cell are taking a message and an action potential is developing when there are the clear space synaptic cleft, which is about 20 to 40 nanometers, and your page edge of the edge of a page is 100 nanometers. So you can imagine how thin the cleft is, but all the messages, the chemical mediators, they kind of transfer from this to this to take the message to the other that creates an action potential. So it is a communication point. It's something like you want a message go to the 10th person, you want to whisper into each other's ear, experimented. By the time you go to the 10th person, the message might have been even misinterpreted. Okay, so it is like that. It goes from one to one to one, to the cell. For each cell, there are 10,000 dendrites, and out of these 10,000 dendrites, 250 cells per minute connect. That brings the whole calculation to 3 million connections per second. Because we are using all the senses. Nothing is a single standalone sensor, and that it is never strong when one standalone one signal is sent. So the brain develops through these experiences. And if there is no experience, if there is no action potential developing because the signal is not accepted by the senses, then there is no transmission. And then we lose 600,000 cells per minute, which is about leaving a scar of 8 to 9 million connections per second. That leads a quantitative deficiency of dopamine receptors, or just receptors, dopamine, serotonin, acetylcholine, or neurotransmitter receptors. There will be a quantitative deficiency because there is scarring, which I have shown in the previous slides how the brain that shut down kind of loses all the sensory input because there is a quantitative deficiency of neurotransmitter receptors, whatever we are thinking about. So here is that picture. As I said, 20 to 40 nanometers is all that is the synaptic cleft. That is expanded and they kind of float over. They find their receptors and then they create a pathway or a potential, sodium, calcium, iron, magnesium, all these along with glutamate that increases the action potentials. So food is very important. We get all this from the food also. So either these get excited or they say, stop, stop, I don't want any more. And they will be inhibitory. Then they're modulators. Okay, you're doing too much of excitement here. There are too much of activities going on. There is a continuous flow of potentials. So to prevent a seizure or anything, gamma aminobutyric acid will be the calming agent. Oxytocin is a calming agent. And you get these through yoga sadhana also. So there are billions and billions of connections. So what do you think is happening here? He's producing more dopamine. He's happily focusing. There is a sustained attention. Here is endorphins released, calming down the brain, the oxytocin, the lactates, the pyruvates, and opioids, cannabinoids that are inherent in the nervous system that the exercise is producing. Here is somebody who is inhibitory. So this is excitatory control, modulatory control, and here is something inhibitory control. I said, oh my gosh, I don't know where I am. I don't want to participate with anything. I don't feel good about it. Serotonin depletion. And so there is inhibitory curve there. And both the dopamine excitatory as well as a calming happy hormones is a family coming together. So with the focus, when there is attention from focus, there is retention. When there is retention, there is memory, referencing for the next experience, and long-term memory to recall and build upon that, scaffold the learning upon that. And so how many synapses are there? There are axon to axon. So axonomic. So this axon is making a synaptic connection with another axon. So you can imagine a network that is almost like a cobweb. So who can sacrifice a working brain? Now we can thankfully study through DTI, flow anisotropy, the gray matter and the white matter, where the messages are going, and the functioning capacity, the thickness of it. Everything is being measured with a little cap, non-invasively through activities. So this is axon to axon, axonomic. Axon to dendrite. So as we showed earlier, the dendrites to the soma, axonodendritic synapse, axonosomatic synapse. From the previous one, it came to the synaptic connection of the other soma, so axonosomatic. There is a gap junction synapse of 1 to 2 nanometers. So that's another peculiar one. And all these come under synaptic plasticity to determine the strength of transmission. Because if we look at these disruptions, when the axon kind of insulates one nerve fiber on the other with the myelin, the messages have to jump over the Reynolds nodes, over these nodes. And that is faster, because there is no such thing as one single transmission. So I don't think anybody can equate to create this kind of a system mathematically rather than the creator itself who has created brain systems that are very helpful for the human being, and the younger the better that we choose, because we lose the opportunity of bringing about changes, the plasticity, or changing an atypical behavior into a state of typical behavior and to a trait of a typical behavior, which is a permanent part of the brain structure for the later life. So there is a thing called as long-term potentiation. One after the other, they'll be firing. They'll be persistently firing, repetitively firing. Fire. Um, the chemical modulators seem to bring about this system over time. And if it is too much, that can lead to seizures. So there are the modulators and regulators that can stop and prevent. Glutamate potentiates it, magnesium controls it, inhibits it. So rapid signal recognition in long-term potentiation, there will be a rapid signal recognition at the postsynaptic junction, learning, memory, enhanced hippocampus. Then this happens when there is a prolonged study period. So here is a representation, colorful representation of each being something. Maybe this is dopamine, this is serotonin, this is glutamate, acetylcholine, you know what. So reward pathways are important, the dopamine pathways, excitatory pathways. So the billions of these connections are happening. And if these get saturated, if these are constantly coming and they're taking the shape, and then they create another electrical circuit post-synaptically, but then these have to be released back into the synaptic space, and there is a reuptake. So when serotonin is down, we kind of want to maintain more serotonin. We do the serotonin reuptake inhibitors in depression treatment. So in the past, Dale's law was that there is only one neurotransmitter per each synapse, but now, Eccles has found there are tons of neurotransmitters. The neurocognitive scientists say there are about 100 neurotransmitters, but we only know of a few. So what are the excitatory transmitters? When it's glutamate, epinephrine, and norepinephrine. If these are there, there is action in the right amount. There is action potential, there is alertness, and there is recognition, memory, transmission to the next synaptic junction. And it enhances the neuronal firing. So the modulatory ones, where they modulate the mood and the functioning of the systems, serotonin for reducing anxiety and giving happiness, dopamine for alertness, and is considered always a learning hormone and a reward system. Norepinephrine is also for learning alertness, but if it gives too much, it causes fogging of the brain. So it is a tweaking neurotransmitter. Inhibitory controls, say, oh gosh, you're too exciting, let's calm down, is the GABA and glycine and serotonin also comes under the inhibitory control. It decreases the neuronal firing. If it is not controlled, there will be too much of anxiety, mania, and seizures. So how do these neurotransmitters go? They diffuse. They are degraded by enzymes, and they clear the synaptic cleft so that more are released from the vesicles in the presynaptic junction. So these are again retaken and recirculated by the vesicles of the presynaptic soma, or the cell membrane. And what kinds of neurotransmitters do we have? We have monoamines for cognition, consciousness, and emotion. Amino acids, there are peptides, and there is acetylcholine for movement. What are the amino acids? Glutamine. Abundance of glutamine increases the alertness, cognitive ability, learning, and it has its effect through the synaptic cleft where the receptors accept the neurotransmitters. And cognitive thinking, strategic planning, everything is from this glutamate. Less of glutamate causes Alzheimer's disease, Parkinson's disease, seizures, dementia, and so on. Gamma-aminobutyric acid is most effective calming and inhibitory neurotransmitter. It regulates sleep. So, if you have too much of serotonin, you have restlessness. It regulates the serotonin amount. It regulates the anxiety. It decreases the irritability. It enhances sleep, and it decreases depression and the trend for seizures by controlling the action potential, transmission, and the serotonin levels. GABA is a stopping agent. So let's calm down agent. Glycine, most common inhibitory in spine and in the central nervous system also, and it's for the pain transmission, hearing processing, and metabolism. We usually deal with the serotonin, dopamine, histamine, norepinephrine, epinephrine, cortisol. These are the acetylcholine to a certain extent. Going to the reward hormones, dopamine. It's for higher cognitive functions. Focus and sustained attention, memory, concentration, mood and motivation, and it heightened arousal for learning and happiness. Too much of dopamine has been seen in mania, and dysregulation leads to schizophrenia, bipolar depression, restless leg syndrome, and ADHD is the deficiency, from the deficiency. So let's reflect for a moment what happens with the dopamine, the learning hormone, from the prefrontal cortex with the video gaming. If you are constantly using this, it goes to a point of no return where dopamine is all depleted. So the reward system is depleted. And then it switches, the brain switches into negative reward system, doing the video gaming again and again and again, and releasing more of the epinephrine, cortisol, and norepinephrine, which scars the brain tissues. So there are 14 neuropsychiatric conditions with the video gaming that starts with poor motivation first, and then the memory loss, and then poor attention focus, leading to ADHD, and including bipolar depression and schizophrenia. 14 neuropsychiatric conditions. These are given in my book, and this is a study from Wuhan, and it was a wonderful study, initial study. Serotonin. Serotonin regulates the pain, regulates the mood, and sleep pattern and anxiety. Not just the melatonin. Serotonin also is a monoamino acid which transmitter, which does all these things and is important in sexuality and appetite in normal amounts. If it is poorly regulated, too much or too little causes depression, fibromyalgia, chronic pain. And so in all of these, in fibromyalgia and depression and chronic pain, we do give slow-releasing substance inhibitors like Lexapro, citalopram, and so on. Histamine regulates alertness, feeding, and motivation. It also causes mucosal edema, asthma, and multi-system symptoms of histamine release. One of the other monoamines are the epinephrine and norepinephrine. These are the fight, flight, fear responses. So if it is hyperarousal, they fight. if it is based upon the situation, it can make somebody foggy and not participate. So the flight is more common with the X chromosome and in females. That's why we miss ADHD, because they don't exhibit hyperarousal, random motor activity, but they are inattentive. And the fight is usually darting out of the classroom, fighting, getting into bullying and fights, and the hyperactivity and impulsivity of the ADHD syndrome. In norepinephrine, a little alertness is important in the prefrontal cortex, cingulate gyrus, and so on, that causes alertness, focus, attention, and decision making. Too much has the opposite effect. The brain becomes foggy. Acetylcholine is important for the movement in the spine as well as in the central nervous system, basal ganglia, and the critical role is in the muscle movement. Excitatory neurotransmitter, acetylcholine, its alertness, focus, memory, motivation, attention, sleep, and learning. Too much is associated with Alzheimer's disease, seizures, and muscle spasms. Dysregulation of neurotransmitters, what happens? Too little or too much release from vesicles in synaptic cleft, which is beyond our control. It is situational. It is based upon the experience. The receptor on the receiving cell, for some reason, is not working properly to transmit the signal. Whatever is the reason, it could be disease or quantitative deficiency if there is a scarring of the brain pathways and the pathways did not develop because the senses were shut down. Multisensory segregation. Damage at synaptic cleft like inflammation, as happens in lupus and other conditions, or like amyloid deposits, for receptors in neurotransmitter is not picked up. Enzyme destruction of neurotransmitter before reaching receptors. Rapid reuptake of neurotransmitters by the previous soma vesicle at the membrane. It releases and it's floating and immediately it kind of sucks it back up. Then you have a selective deficiency of particular hormone that needs to work, neurotransmitter that needs to work. Medicines that are being taken may interfere or block the neurotransmitters. Diseases from deficiency. Less acetylcholine leads to loss of memory and Alzheimer's. Increased serotonin, increased anxiety is seen in autism spectrum disorders. High glutamate and decreased GABA activity increases firing and seizures. High glutamate excitatory, GABA should be inhibitory, and the firing and increases the firing if the glutamate is high and GABA is low. Seizures can happen. High activity of dopamine, norepinephrine, and glutamate imbalance leads to mania. Neurotransmitter regulation through medication. And it is important to note that donepezil has improved the social relationships. Galantamine and rivastigmine decrease the repetitive behaviors, echolalia, in autism spectrum disorder. These block the enzyme acetylcholine esterase that breaks down the acetylcholine. So this donepezil, galantamine, and rivastigmine that are being used with some results that are not well widely published is used in ASD, Alzheimer's, to improve memory, cognitive function, and found useful in autism spectrum disorder. In other words, acetylcholine levels are maintained or increased. So lithium blocks the norepinephrine in mania of bipolar depression. So here is the summum bonum. Excitatory is epinephrine, norepinephrine, cortisol, dopamine, serotonin. Inhibitory, serotonin, oxytocin, acetylcholine. Gamma-aminobutyric acid and glutamate are the modulators. Now there is another important factor, which is peptides, the opioids, cannabinoids that are naturally present in the hypothalamic pituitary adrenal axis area. These are released as a result of pain. So when you have a pain from a fracture, you release this natural opioid so you can tolerate that pain. Some people have used this one through mindful practices and internal relaxation to increase the opioids. You'll be surprised to know that people like spicy food because there is hot spicy food, really heated up, because there is no taste for spice other than salt, sugar, bitterness. It causes pain, it causes discomfort, and that increases the opioid levels that makes a person feel well after eating pica or the hot spices. So we can release these through physical workout, hot spicy food, or through mindful practices and acetylcholine. So every neurotransmitter has a purpose, and it's a fraction of a second transmissions happen excitatory. Imagine for a moment you are not actually eating anything, and you can actually document these on fMRI, the functioning, they can be picked up. You're thinking about apple with a peanut butter, honey peanut butter, and you're very fond of that. You're thinking about it. Immediately your brain has mastered the sensation, and your interoception is that you're already mouth watering, and you feel that you already have it in your mouth, and you're really slurping, and there is a lot of saliva. Same thing with ice cream, pizza, jambalaya juice, whatever thought comes, it's already mastered in the mind, and there is a sensory, somatic sensory thing that happens. Sometimes intestines even squeezy, looking for that. Is this what is called interoception? Mastering the mind with the previous experiences, and you have this gut feeling. Anger, love, peace, hunger, sadness are all feelings from interoception of a thought. It's a thought. Some people just are devotional. The moment they think about their spiritual guru or anything, they're excited, they're happy, and their dopamine levels surge up, to discuss anything. But on the other hand, some people just calm down with the spiritual guru's practices. So you can teach wonderful things to a child from this picture. In this picture, there are all the things that the kid can intentionally teach, creating pathways for future educational support. We can talk about the colors, we can talk about the shapes, we can talk about the music and the notes and the numbers, whatever. This little toddler who is about 15 to 18 months, with this loving interaction with the mother as the teacher and a caregiver, can explain numeracy, explain pattern recognition, explain colors, and as they play with each other. And this is the essential part as described by Shazen and Cohen in the curriculum development for 0 to 36 months. We can teach wonderful things through the power of play and the presence of the adult caregiver with the joint attention, helping them doing, guiding them to do a certain task, power of being in sync with their emotions, power of following child's interest, power of being a guide to demonstrate and scaffold, and the support has to be intentional. Infants know if it is intentional or not. Can we do this with the storytelling? Yes, we can take cardboard books for a 2-month-old, but we can take regular flip pages and let the child touch the pages of the book, be in proximity, so and reachable in bins that books are kept. Children know. If you have done 2 or 3 times, a 9-month-old know how to crawl to the book place and get the book out, cruise up and get that. While we are doing peekaboo, we can teach memory. While we are telling a story, we can label, we can point out, we can make imitations, we can be in sync with emotions, we can talk about various emotions as with the pictures and everything. As we sing, it is beautiful that children know how to parse a word properly. That is inherent um, talent, implicit talent of every child. Interoception, you could call it. Why would a child not say good boy and good girl? They clap where they can understand geo goo, the boy, good girl, the girl. But they seem to parse it to good and girl separately or good and boy separately. So there is so much of interoception. I call it as interoception because these are inherent talents of every child that we have ignored it. So the more we talk with them, the more we are teaching, the more we are giving bath time, bedtime, story time, putting clothes time in response to the action in real time, narrate what they're doing. Children learn, they have mirror cells, they imitate you, they watch your lip movement, they watch your moods also. So you cannot frown and change a diaper, you cannot frown and take them to give a bath or anything. So it is called as playful teaching and learning, transferring learning. So why play? When you leave a child with a bunch of toys, immediately they take to play, exploring the toy and playing with the toy. It is their natural concept development of born scientists as they are. That invokes the curiosity in them. It creates a creativity. You can give a wool or strands. Children know how to play with that and sit there quietly for a length of time. And then when a peer group is working together in a play, the social skills are enhanced. They exchange ideas. They help each other. Camaraderie is built up. Understanding is developed. We get over the inequities and we get over the cultural diversity. So active engagement by parents is very, very important. So what we are investing, we are trying to make them very intelligent after the brain has already peaked its cognitive abilities, although they are connected to the prefrontal cortex until 16 years of age through the experiences. But the basic frame of mind, whether I am wanted, I have positive relationships, I have a secure home or not, is already lost after the 5 to 6 years of age. 8, maybe they're still there. But look at the rapid drop of curve. We are trying to fix problems here when we pick them up because of the symptoms. But what if we all, globally across the world, focus on preventing in creating sensory pathways, motor pathways, cognitive pathways, linguistic abilities pathways, social emotional pathways for the social intelligence, emotional intelligence before the child is 12 months. That's where we are stressing right now. Joint attention is like a dance partner, you're finding the child's interest, you're trying to teach the child by asking questions, being innocent, and they're getting the answers from them. They're very intelligent. They come up with the beautiful answers. guiding them, demonstrating them, working with them, validating their emotions. And this joint activity really helps everything. There is love, compassion, comfort, self, for which adult needs their self-care. They need to be in control of their emotions through all the routines. They're eager to learn. Even this little baby, 4 months, cannot even sit. As mommy is speaking, as she's showing, as she's labeling, and she's intensely watching. And I've seen this happen time and again. There we can teach the positive and negative emotions. We can validate the emotions. We can give love and sympathy. So if the child comes crying, we are not going to say, oh, it's okay, you fell down. You fell down, it is hurting you. Never say they're not hurting. The way you handle is important. So if you take this task of validating emotions, validate, give your shoulder, give the hug, give the comfort, and then explain what we can do. And they immediately calm down with the crying. So we talked about massage therapies, bicycling exercises, multisensory integration. You play music at the same time, you have tummy times, you have supine, you make eye contact. Everything is an asset. Everything is a standalone asset for them. So although we talked about the senses, main senses are five: visual, auditory, kinesthetic, touch, and smell. But vestibular for the balancing, and the proprioception, putting where you are on earth, where you are, where your joints are, where you are standing on. Interoception is something like a deduction of feeling, the intuition. You already know, you're getting hungry, you're getting smart, the senses feeling something that you want to control or you want to express. That is interoception, and that is implicit learning capabilities naturally present, probably 50% genetic, 50% is trained. So everything that they go through is an experience for them, first time experience. And whenever you are touching a ball, you're not just touching the ball, you're getting the feel of the ball, you're getting the weight of the ball, you're getting the purpose of the ball. That's also a cognitive development. So it has to be face-to-face communication. It has to be gentle touch, smiling face, talking constantly, comforting the child, not moving them up and down, but holding them like this, because moving up and down can break the blood vessels, cause a shaken baby syndrome. And the emotional regulation is only the adult caregiver who can give that compassionate skin contact and love and sympathy for the child. So every routine is an opportunity for enhancing the developmental trajectory in terms of sight, sound, taste, touch, and smell. Words, syntax has to be rich. Multiple languages need to be taught. Numbers can be taught. Everything from the beginning, they're going as a sensory thematic representation in the brain, and they can spit it out, as a behavior. An example is here is a child waiting to talk to an adult, and the adult is not there. This happens repetitiously, child withdraws. Has nothing to do with looking at an adult, listening to the adult, making attachment with the adult. A rigid parenting where there is anger. I said so, you're going to do that. And the child is crying because they are not felt to be respected. They're very sensitive to that feeling. When adults don't know that children are really hurting when the adults are fighting, it really scares them. And there are so many houses, if 1 out of 4 women are abused, if 1 out of 7 men are abused, there are always clashes, either from the in-laws or from the spouse. And when there are loud arguments rather than loving discussions, when you can talk obligingly, although one does not oblige with the other, kids, the sensory segregation happens. They pull themselves inward. They disregard and disengage with the world. We need to be respectful of how to engage the child. They look away, they cover their ears, they won't listen, they won't respect, if you say anything. But if the parent is in control, the parent is in control of their own emotions, the parent is calm, they will listen. So the most common things that we are anger, rigid parenting, depression, inebriation, mental weaknesses, anything. So we have to work with the vulnerability, inequities, cultural diversity, poverty, missed opportunities, migrant labor population, and the risk factors. There is an autistic kid already, and there is economic burden already, and there is no accountability of our behavior. The violation potential gets triggered off and the boundaries violate, and there will be behavioral outcomes that are from the scarred brain. There is learning disability, there is poor attention, there is explosive temper coming from the reptilian brain. There is no connection here. There is a quantitative deficiency of dopamine, serotonin, oxytocin receptors. So the only chemical that comes up is epinephrine, norepinephrine, cortisol. They cannot understand anything. It's a scarred brain. When did this happen? Before the child even turned 12 months, because 150% of gray matter, 101% of the connectivity synapses happening in the first birthday. So warning signs, you need to pick up not only the motor development, but how the senses are listening. Is the child looking? Is the child turning towards face, name, and calling? Is the child enjoying? Is the child smiling? Is the child looking? All these are important. Is the child interested in anything? So early recognition and undoing that state and trait to proper desirable state and trait can be easily done with the forced habit and play therapies, the 0 to 3. Here is a beautiful world with the cultural diversity, integrity. The families are working together. There is science there, there is math there, there is linguistic abilities, they're creating robots. We can create a beautiful world. So I will play this video.
Think of all the thinking skills that children develop in the first 3 years. Understanding cause and effect is an early sign of baby's intelligence. At first, they experience the effect of their actions by coincidence, like their body movements accidentally making a toy jingle. They don't make the connection between their action and its result. But between 6 and 8 months, babies discover that they can really make things happen. So they begin to act with purpose to produce a desired outcome, like pushing the button to make the toy pop up, or covering their face to play peekaboo. During the first 3 years, children are also learning about spatial relationships, or how things fit together. Children use this skill to solve everyday problems, like putting objects in and out of containers, or turning objects around until they find the way it works, like when this child turns the plane around to face forward. Toddlers also learn that objects are comprised of parts, and that these parts can be combined to do or make something new. This knowledge allows them to stack rings, build a house with blocks, and do puzzles. And then there is classification, the ability to compare similarities and differences, and organize objects into groups. Young toddlers learn to match and sort, which helps them organize the information they receive from the world around them. By 2.5, children are learning about size and can stack cups or rings from smallest to largest. By 3, they are also learning about quantity and understand numerical concepts like 1 and 2. These thinking skills allow children to see patterns, understand the number sequence, and make comparisons in the world around them. Finally, symbolic thinking skills begin to emerge between 24 and 36 months. Symbolic thinking is the ability to use a substitute, like this box, to stand in for another object, like a car. Symbolic thinking skills are necessary for understanding that words are symbols for objects and people, and for understanding number concepts as well. Together, all of these skills help children understand how their world works and gives them the tools they need to solve problems, organize information, construct new knowledge, and use their imaginations. You are helping her build thinking skills. And like framing a house, these skills form a strong foundation for new learning that your child will continue building for the rest of her life.